Good afternoon. The District Board of Health is meeting, and I'm calling it to order. It is 1:03. Sorry, we're 3 minutes late. Madam Clerk, can you please do a roll call and determine whether or not we have a quorum?
Yes, ma'am. Kitty Chung.
Present.
Dr. Novak.
Present.
Oscar Delgado. Here. Dr. Hess. Here. Christopher Dare.
Here.
Mike Brown.
Here.
Tom Young.
Here.
We have a quorum.
Thank you, Madam Clerk. Item number 2 is Pledge of Allegiance. I would like to ask Dr. Slonim if you'd be so kind to lead us in that.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Dr. Slonim. Madam Clerk, do we have public comment?
Not at this time, Madam Chair.
Okay, thank you. Item number 4 is approval of today's agenda, May 24th. Does anybody have any changes or additions, or are you okay with approving it?
I move to accept it.
Second?
I have a motion by Novak, a second by Delgado. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item number 5 is recognitions. District Health Officer Kevin Dick, you can take it away from here.
Thank you, Madam Chair. First today, I'd like to recognize a couple of employees that have received promotions, and I don't believe that they're here today, but we have Jennifer Pierce, and Jennifer was introduced to you at our meeting last month, and we had a vacancy occur, and she has already been promoted from principal account clerk to fiscal compliance officer. So she transferred to the health district as a principal account clerk, and I've already cautioned her that not to expect the promotions to proceed at this pace. But congratulations to Jennifer. And then Kelly Verling, Public Health Nurse 1 to Public Health Nurse 2 for promotion. We have a new hire, an environmental health specialist trainee in environmental health services, Tyler Henderson. And I believe Tyler is being trained right now, so he's not able to attend. We are going to do the resolutions of appreciation at the meeting next month.
So that has been continued. Item 5C.
Thank you. And then we have wanted to note a couple of accomplishments that we've had with the health district. The University of Nevada, Reno School of Community Health Sciences had a very nice event last month where they recognized the partners in the community that had hosted interns for them and did particularly good work with the school. And so I wanted to recognize Kelly Goatley Seals. She received recognition there as she received the Community Partner Collaboration Award from UNR for her work with interns here. And also wanted to inform the board that the health district received the Spread Health Award from UNR for being the organization that had the most interns work through our programs over the years. So I just
Congratulations, and I'm so glad to hear that because that is a pipeline that we use for the areas of expertise and advanced degrees that we need to function as a health district.
So, and Kelly, if you could stick around, we'll and wave to the crowd. We'll get a picture with you and the board. So next item we have is proclamations, and we have Emergency Medical Services Week, and so I will move to the podium, and I would invite all of our EMS providers that are present to join me for receiving the proclamation.
Oh, sorry, thank you. That's what you're trying to say to me.
Okay. Proclamation for Emergency Medical Services Week. Whereas emergency medical services personnel are called upon to help others through one of the most frightening times in their lives, and whereas emergency medical services is a vital public service with personnel ready to provide life-saving care to the community 24 hours a day, 7 days a week, and whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury, and whereas the emergency medical services system consists of men and women in both the public and private sectors, including emergency physicians, emergency nurses, emergency dispatchers, emergency medical technicians, paramedics, firefighters, educators, administrators, volunteers, and others throughout our healthcare system who work together to ensure those in need receive the highest level of emergency service. And whereas the EMS commitment to patient care throughout Northern Nevada has been an integral factor in our safety and security, and whereas Washoe County is proud to have organizations such as Reno Fire Department, Sparks Fire Department, Truckee Meadows Fire Protection District, North Lake Tahoe Fire Protection District, Reno Tahoe Airport Authority Fire Department, Pyramid Lake Fire EMS, Gerlach Volunteer Fire Department, REMSA, and CareFlight operating throughout the region to ensure the highest quality of patient care and community support. And whereas the members of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance our life-saving skills, to enhance their life-saving skills. And whereas it is appropriate to recognize the value and accomplishments of emergency medical services providers by designating Emergency Medical Services Week, now therefore be it resolved that the Washoe County District Board of Health does hereby proclaim the week of May 20th through 26th, 2018 as Emergency Medical Services Week with the theme EMS Strong, Stronger Together in Washoe County, Nevada, adopted this 24th day of May 2018. Kitty Jung, Chair, Washoe County District Board of Health. I'd like to present this proclamation to Christine, who's accepting it. I don't know if anybody would like to make some remarks, and then we'll do a picture.
I'm sure the chiefs do.
I think Kevin said it all. You did a fine job.
Thank you.
All right, well, let's get
Let's do a photograph board. Yep. And then Kelly, you're next, okay? Put your lipstick on.
Yeah. Good job. Well, hi, haven't seen you in ever. I sure do. That's right. Yes. Yeah, but they're cards. Okay, on three, please. 1, 2, 3. And one more. 1, 2, 3. Thank you. Yeah. Good.
Oscar, Dr. Hess, we have one more. Thank you. That's quite the honor.
One more time on three. 1, 2, 3. Excellent. Thank you. We need our sticker back.
Oh, I know. That's what happened. I think they thought that we're trained enough by now. I'll let them know. Where to go? Okay. Congratulations to the emergency medical services and all that you do to keep our community safe and healthy and happy, and thanks for always being here, too. It doesn't go unnoticed. I appreciate it. And then also, Kelly Goatley Seals, congratulations, and she's gone. She has to go back to work. We would greatly appreciate that she goes above and beyond in every aspect of her job, and one of our true health assets here at the Board of Health. I think I could say that without being out of line, yeah?
Absolutely.
Okay, thanks. All right, that takes us to item number, oh wait, we need to take action on item number 6. Do I have a motion?
Second.
I have a motion by Brown, second by Novak. Any further discussion? Any public comment? Thank you, Madam Clerk. All those in favor signify by saying aye.
Aye.
Any opposed? That motion carries unanimously. That takes us to consent items. Excuse me. Does anybody have anything they would like to pull out for further discussion?
I move to approve the consent items as they are.
Second.
I have a motion by Dare, a second by Novak, and I do want to bring to your attention item 7, B as in boy 2. We are accepting a cash donation of $5,000 from Arctica Ice Sales, and this is so that we can purchase long-acting reversible contraceptives to help decrease unintended pregnancy rates. So we really appreciate that donation from Arctica Ice. Yeah. Okay, that motion carried unanimously, yeah? Item number 8.
Oh, there was no vote.
There wasn't a vote? Yeah, I had a motion and a second. Oh, okay. All those in favor signify by saying aye. Aye. Any opposed? That is a unanimous vote. Now, the item we've all been waiting for, just kidding, Dr. Sola. I mean, yeah, we're waiting. This is Dr. Anthony Slonim from Renown. He's the CEO and has so many degrees behind his last name that he's kind of my idol. And he's here at the request of Councilman Delgado to present on Renown's community benefits plan. Thank you so much for being here.
Thanks so much, Madam Chair, and Councilman Delgado, for the opportunity to address this austere board. You know, I think I'm joined by so many great Renown Health team members that are here with me to share the message of so many things that we're doing. And I'll speak today, my comments will be based on the work at Renown Health, although I am also honored to serve in the capacity with Mr. Dick as the co-chair of the Truckee Meadows Healthy Communities Project, which you guys are so informed about. I thought that what we would do is a couple of things. We would first understand a little bit about how to make the slides advance. Doesn't seem to be working. There we go. To take a look at, you know, a couple of years ago, we had the great fortune of being able to put our heads together as a community and try to solve problems together from a health perspective. And I think that that's really working out to our benefit. The more that we attack problems and not each other, the better off we're certainly going to be at improving the health of our community. And so several years ago, to the great credit of the teams that got together at that time, we did together with the health districts a community health needs assessment, Renown Health and the health district, to be able to understand together where our vulnerabilities were. And these were lots of other not-for-profits in the community participated in this work, and these were some of the priority areas: access to health care, social services, education, food security, behavioral health. And Renown Health, over the course of that period of time, has attempted to figure out ways in which we can contribute to the broader health improvement plan. So the way that this all works, as you know, is you do an assessment, you come up with a plan, you work the plan, you try to make a difference, and hopefully we're improving the health of the community as we move forward. For the new community benefits plan, we've just now gone through that assessment again. And we've identified a couple other different areas: chronic disease, homelessness, other areas where as a community we need to focus. And so for the next fiscal year, which ours starts in July of this year, Renown Health has budgeted $1 million to partner with community-based organizations. They all submitted proposals to where we had our priority areas, which align with the CHIP for next year based on our health needs assessment. And we have now identified the organizations that will receive funding from Renown Health to be able to help us address the issues of chronic disease, asthma, diabetes, adolescent suicide, and mental illness in the community. And we think that not only was the health needs assessment a vital piece of work because we change over time, but what's also important is that it sets up for us a body of work on where we should improve and how we should improve. And we have so many great partners, both in the health district and at Renown Health, that are helping us to accomplish this work. It's not one team, it's not one organization, it's all of us coming together with a spirit of inclusion that will ultimately solve these crises we have in our community. And so I want to spend a moment thinking with you about some definitions, because this gets to be fuzzy, and unless we're clear on the context, we will actually lose some of the value of it. So the next part of my presentation will be divided into three major parts, and I'm going to hit briefly for you community benefit, community development, and community investment. And what do those three different concepts actually mean? Because as a health district board, it's vital for you to understand the difference. Renown is the only not-for-profit, or is a not-for-profit health system, integrated health system here in Northern Nevada. And by virtue of the Internal Revenue Service Code, we are responsible for community benefit dollars. That's community benefit contribution. That's how we keep our not-for-profit health status. And community benefit specifically refers to dollars that are reportable to the IRS and the state of Nevada as community benefit dollars. And I'll share with you some of the ways in which we've invested in those areas, many of which intersect with the Community Health Improvement Plan that we alluded to earlier. The second construct is community development. These refer to dollars that we spend for internal or external efforts related to community investment, but while they can improve the community's health, they don't get counted as community benefit contribution. Nonetheless, they're important for improving the community's health and the work that we want to accomplish for the citizens of our community. The third construct is community investment. This refers to internal efforts that have a direct impact on the community by improving access or services, but don't, again, get included in community benefits. It's important for us to all understand that halo in order for us to better understand where we're making contributions from a health perspective. And while we're very proud of our not-for-profit status and our contributions to the community, nuanced terminology, that means that the money that we derive from operations gets reinvested in the programming we've come up with. That does not mean that we don't pay taxes. We're very proud of the fact that Renown Health continues to contribute. Last fiscal year was $11 million we paid in taxes because we have business constructs that need to make sure that we're participating as a broader citizen in the community. So we're very proud of that not-for-profit status, but let's be clear that that does not mean that we are exempt from our contributions more publicly. As we move on, the next series of slides will be really quickly the kinds of things that we've done under that community benefits umbrella, if you will. And Councilman Delgado, this is specifically relevant to the question that you asked, and so we're happy to provide some examples of where we've contributed. In aggregate, in last year, Renown Health spent $120 million in response to community needs, and that has gone up each year over the last 3 years. $78 million in 2015, $98 million in 2016, and $120 million last year. And community benefit refers to the dollars in a variety of classes. $101 million went to free or discounted care for the underinsured in 2017, $8 million in free and low-cost community health services, primarily in the red zip codes, the hot spots of our community, where we know that we needed further investment. That included about $3 million in specific financial assistance for people who were unable to pay, nearly $2 million for the pregnancy center to serve 1,500 uninsured moms from those priority zip codes, $400,000 for free health coaching, almost $400,000 for a very important EMS week, and we certainly value the contributions of our EMS colleagues and the great work that they do in town. But we get involved and make sure REMSA came up with an amazing program a few years ago funded by CMS, but for the fact that those programs would be extinguished if someone wasn't there to make sure that they continued. And so we're very proud of the opportunity to have provided nearly $400,000 to continue the REMSA nurse hotline, which provides valuable insight and assures efficiency in the way that we deliver emergency services around the community. Free health information that's reliable is important. We do that in a variety of ways, and you see the benefit there. And health and wellness programs, particularly educational programming on good nutrition and diet for patients with cardiology, which is a world-class Pritikin program, and now we're revolving that into making sure that patients with cancer get adequate nutrition as well. $150,000 for mental health and addiction screening, and I hope that you have all received the invitation to next week on the 30th. We will be joined by the governor to announce a new Behavioral Health and Addiction Institute with the generous support of a community donor that will help bring critical services to our community, which has been in crisis around this topic of mental health and addiction for not only for the recent past, but for decades. And we're very proud of that work and very appreciative of the support from that donation. Safe Kids, the kids are our future, making sure that they have car seats available. This was a program that was being extinguished in town. Somebody had to step up to make sure that people who couldn't afford them got free car seats. We did that as a part of that work. And then again, public health is all about prevention. What are we doing to prevent head injuries, making sure kids get bicycle helmets and make sure they know how to use them so that we keep them safe. Health professions education, $5.5 million. We are proud of our partnership with the University of Nevada, Reno, as you know, School of Medicine. But it's not only the School of Medicine where we invested, oh my God, over the last 3 years or so, close to $10 million. It is the new physician assistance program and other health professions education that we are proud to be a co-sponsor of, making a difference because we know that we are underserved. And as I say, often at the Truckee Meadows Healthy Communities Project, not a lot of other organizations in town actually hire physicians. Renown Health is one of the ones that does, and so we want to make sure we're making a contribution there. About $3 million in research from health programming and other contributions. I hope that many of you are aware of the great work going on. It's getting national and worldwide acclaim, the Healthy Nevada Project to provide population-based genetic screening, one of only 2 organizations in the United States doing this, to 50,000 northern Nevadans, and we hope to expand this to southern Nevada in the next year. The only people in competition with us nationally on this is Geisinger Health System in Danville, Pennsylvania. We have a number of community partners. Community Health Alliance for dental visits. We're proud to support vaccinations with Immunize Nevada and mammography services with Northern Nevada Hopes, all great partners in assuring that the impoverished in our community get access to good care. Catholic Charities, again. Urban Roots, where we focus on how we make sure students learn how to grow and get donations of food, and then Girls on the Rung, who are helping us to advance our work for young women and how they can aspire to be anything that they want. Proud sponsors of the Family Health Festival, and as you know well from the report that was provided, this was the first year in a long time that we provided the RAM event to those people who could not afford access to health care. And Renown Health, again, not only with in-kind contributions of our staff, but with real monetary contributions, made a difference for over 2,500 families this past year. If we could turn our attention now to that community development bucket, again, this does not get included under community benefit, but you'll see by virtue of the examples we use how important they are to driving the health and health care of our community in Northern Nevada. One of the things I hope you are aware of is Renown Health's strategic partnership with Stanford Health to improve access to care for quaternary services that may affect Northern Nevadans. And for those, including Washoe County and the City of Reno and other members who are proud members of Hometown Health, where they are getting their insurance through a Renown Health subsidiary, Stanford Health is in-network benefit to those members, and that's really, really important. An in-network benefit to Stanford means if you need specialty care that we can't provide here in Northern Nevada, that's covered by your insurance plan. So City of Sparks County, City of Reno, many of the casinos in town are important members of Hometown Health, and this is an in-network benefit that we're really proud of. Housing is a major priority for us in the health improvement plan. As you know, we are struggling with affordable housing here, and as a way to try and make a difference in pilot test projects, we have 3 homes across from our rehab hospital right on Mill Street that we have made available for homeless families. And we've been housing them with the idea that not only will we give them a safe place to live, but there are people there that we might educate within the health professions. As you know, we are one of the largest employers in the county and Northern Nevada, and we want to make sure that we're giving people an opportunity to differentiate themselves, get educated, get trained, give them jobs, and then give them other opportunities to get housing around town with affordable jobs so that we can backfill them in these affordable housing and do that with another cycle of people. Another really important opportunity focused on families and how to improve. Because if we don't get, as a community, to those social determinants of health, people will not live healthier. Uber rides, making sure people get access. How are we doing community support not only locally but via telemedicine to the remote areas of Northern Nevada, and partnering with senior caregivers and child health caregivers in the community to make sure that we're making a difference for those vulnerable people that we serve. Many, many kids with food insecurity, using publicly available 211 hotlines for community food programming, and this institute, which comes online next week, which we're so very, very proud of. And then the final category, community investment, again, not included under the umbrella of community benefit, but you'll see so many things that we're doing that allow us to provide the kinds of care you come to expect from an integrated health system that serves you and your family's health and healthcare needs. $210 million over the last 2 years to improve access to health and healthcare. And these come directly from the Health Improvement Plan. Committed to making sure there's access to hospital beds. We just announced, with the generous acknowledgement of the Renown Health Board, a $20 million commitment to build out a new patient floor of private rooms at Renown Regional, because we know we're underbedded in the community. That will improve access to hospital beds and really allow us to free up the kinds of things that we need to do at the trauma center. A $2 million commitment to urgent and emergency care access. We are expanding hours at our urgent care up the block from Regional Medical Center, where we serve the underserved, including those who can't pay and with Medicaid, and are expanding those urgent care hours from 7 a.m. to 11 p.m. so patients insured by Medicaid no longer need to use the emergency department as their primary care doctor off hours. That will hopefully offload the emergency department from a capacity perspective and give those members of our community in those priority zip codes 89502 and 3 a real place to go when they have a crisis that can't be managed by a primary care doctor or they can't get access. $12 million in 2016 to open 5 new primary care sites in our community. We have hired 175 new providers over the last 2 years and are on track for another 200 in the next 2 years to drive this access issue. Capital commitments for 5 new primary care locations in this next fiscal year in 2018 and 19. And that growth, while we often will get picked on because of the size and the scope of the services that we are offering, is important if we're going to overcome the needs of the community from a health care challenge perspective. We believe it is our responsibility as a part of our commitment to serving that we are investing in these areas. Nearly $2 million in new lab technology, $2.5 million in cardiac technologies, $2 million in imaging, and $8 million in advancing surgical techniques, where people where we can provide our rural hospitals access to skilled surgeons telemedically, and we can have Stanford surgeons remote into our operating rooms so that we can get in operating room consultation as needed for members of our community undergoing surgical care. Primary and specialty care available in Tonopah, and this is one of the things I am most proud of, and goes to a question that our board struggles with, which is, who is our community? When you talk about community benefit, who are you here to serve? The way that we approach this is it's Northern Nevada. 2 years ago, I received a call from the then CEO of Nye Regional Hospital in Tonopah, and they said they had very few cash days on hand, and they were going to close unless they received a loan. And how were those citizens going to get access to health care and healthcare services? And we're very proud of the fact that we stepped up nearly 4 hours away to be able to make sure that no one in Nevada gets treated like they're in a third world country. And now in a partnership that we have going on with REMSA, we're providing population-based health services to that community, 2,000 members of that community that they would never have had if we would have just let this be extinguished. So very important investment that I think we all would agree, not counted in community benefit, but certainly valuable for the 2,000 people on the ground in Tonopah. Our expansion of telemedicine, so you don't have to put people on the ground, but you can still help them. Making sure that we're involving not only the physical domain of your health, but also the mental health component and the spiritual health component to making you whole. Generous support that we're getting from donors in the community and our new Interfaith Spiritual Center, which we just dedicated in the last week. Our new providers, I mentioned, 22 new pediatric specialists in town because of the generous support of the Pennington Foundation, where children and their families for complex conditions like cancer no longer need to leave the community, but can get that care right here at home. Because when you have cancer, you want to be surrounded by your family and your friends. We're proud of the 7,000 team members who join us. As a large employer, we have a responsibility not only to our community, but to their goals, dreams, and aspirations. And while there is so much here that I've covered in a brief period of time, there is also so much more that we're attempting to do in service to the community as we try and be a good partner, not only on the health side of the equation, but on the economic development side of the equation, on the personnel side, on the making Northern Nevada the place where not only all of us want to live, but where other people might seek us out because it is the place to live. Thank you again so much for the opportunity to address the board, and I'd be happy to answer any questions if you have them.
All right, thank you, Dr. Slonim. Any questions down here?
Go for it.
With this community growing at this non-steady pace here, it's just going up, and you certainly address some of your needs to enlarge the facilities and things like that. I'm very, very worried about the health department being able to keep up here too with resources. But what kind of personnel challenges are you foreseeing in the future to accept this growth?
Sure, I guess there's a couple of things I would say. One, the first comment is, so to date, we have not had difficulty recruiting either physicians or other team members, whether they're in the financial sphere. Over the course of the last 3 to 4 years, we've been highly successful in recruiting people from around the nation outside of Nevada to Northern Nevada. And we think it's in part because of what we're hoping to do for the community, and people really latch on to that and want to be a part of something that is special. I think that one challenge that we have, though, is that healthcare workers in Northern Nevada are limited. And to the extent that we're all aware that there's a new hospital that's going to open up south of town, that will increase competition for that very precious resource of doctors, nurses, et cetera, and will incur into the community, from a health perspective, challenges that we're currently not confronting. And so we continue to need to recruit, we need to continue to drive that pipeline, and we need to continue to make sure that we're investing in what I like to call population health strategies to keep people as healthy as they can so they hopefully won't even need a hospital. That's the goal, but we're some ways away from that. We're not going to put ourselves out of business, I don't think, anytime soon by some of the community programming. But prevention is important, and that's why we're focused on it.
Sure, thanks.
Councilman Delgado?
Yeah, thank you. Thank you, Dr. Sloan, for being here today. It's a lot more information than I even thought that you would bring forward to it, but thank you for sharing. My questions, aside from everything else you guys are doing, is strictly focused on the community benefit piece. And the questions I'd asked of Mr. Dick here is, how does one, from profits that are generated from a nonprofit hospital, how do you guys decide year on end as to how much to give back to the community? I know that's a broad kind of, every hospital across the nation is a little bit different. I don't think there's a set number or set balance or a percentage. Has that increased or has that decreased? And those are numbers that I was asking for maybe over the last 5 years from within the city of Reno.
Absolutely.
Or within Webster County.
Absolutely, Councilman, thank you for the question. So as I highlighted, broad umbrella, community benefit, one of the buckets, other two elements under that umbrella that continue to contribute to the health improvement plan, regardless of whether they're counted or not counted. The first question is, how are they counted and to what degree is that determined? That's determined by IRS statute. And so they drive the kind of what you contribute to and what that looks like. And to the second part of your question, again, the response is in 2015, $78 million, in 2016, $98 million, and in 2017, $120 million. And that's only in that one bucket called community benefit, not including the other two buckets of investment that Renown Health has made to improve the health and the healthcare benefits of the community.
Does that, and I'm not gonna, we could probably talk offline as well, but more of a just for us, as when we're challenged year after year in terms of even revenue, of keeping the district moving. We'd like to see what our community partners in terms of how to move the needle. I know that was the ultimate goal for the Chucky Meadows Healthy Communities. I believe you guys are still trying to achieve that mission and vision. And even then, the focus there, and this is what I talk to Mr. Dick about quite often, is, and I appreciate the Healthy Nevada project that you guys are working on. But I think there's a general understanding too that it's not necessarily genes, but it's also the zip codes from where people live.
Say that again, I'm sorry.
It's not necessarily just the genes that one is born with, but it's also the environment, the zip codes that people live in. And up here, we are quite often dealing with the population that live in those 89502 zip codes, those zip codes that need access to care. And so I look at the community benefit in terms of how we deal with it here through the CHIP, or the community benefit through a nonprofit such as yourselves, in terms of how are you guys tackling those initiatives? How is the community involved in creating your plan? How do you guys put those funds and those resources to tackle those health challenges, those community challenges, those social determinants that you're speaking to? Because I feel like there's some gray in terms of how things are driving. Is the community really part of those conversations, or is that, how does one decide?
Oh, I would be very disappointed that there's that perception of grayness, because it's really clear. Let me share with you a little bit about how it works. First, there's a health needs assessment. Renown Health and the district came together and co-sponsored that body of work. In fact, Renown Health contributed to the FTEs that performed the work. Then, out of that health needs assessment, there's a health improvement plan that's very public and gets input from a whole number of people, including focus groups, and I'm sure you participated in those kinds of things.
I was going to ask when it was going to be published. I haven't seen it online yet.
I'm sorry?
It's not published online yet on your guys' hospitals. I was wondering.
It's not actually yet. We're actually still working through the focus groups for the health improvement plan and what those buckets of work are, but they've been published as a part of where the needs assessment drives to the improvement plan. As a part of that, Renown Health has a very robust community health benefits group that works together, and they actually sent out requests for proposals for all of the not-for-profits in the community based on the priority areas that came from the health needs assessment. I think we had 27 applications that were just contributed as a way of not-for-profits participating in our efforts to improve the health of the community based on the 4 priority areas, again, that were identified in the health needs assessment. those programs had structure around them in terms of what outcomes, what dollar amounts, and how they were going to be allocated based on where we could contribute and where we thought we had the most opportunity for impact. That's where some of those highlighted priority areas that I identified came through. They include chronic disease conditions like diabetes, where there's been a very large investment, the issues on homelessness, which I highlighted in terms of our partnerships with others, including Children's Cabinet and others, where we're housing homeless families, other things around behavioral health and addiction. That new institute opens next week. So we are partnering with very broadly across the community, not only on sharing the great work that went on in the needs assessment, but identifying where they can make independent individual impacts funded by Renown Health. That's the most important part. Funded by Renown Health, so they can carry on their not-for-profit mission and make a difference in the community.
And Madam Chair, my apologies, I don't want to take up everyone's time here. Just to follow up with that, I know you had shared, and since you're here, also is the partnerships, I think those, as to your stated earlier, no, we need everyone to partner and to work together in order to achieve, especially these big voids that we have in our community. Some of the partnerships that you highlighted up on the screen were because of our issues related to diabetes or obesity issues, especially with our young ladies, the Girls on the Run. My understanding is that that relationship is no longer going to exist here after this next fiscal year, or that's dissolving. Is that right?
Girls on the Run partnership.
Correct.
We support Girls on the Run in a variety of ways, and
The direct, but
as
the
you can understand, there
direct
are-
grant to them. My understanding from here and in the community, the direct grant to Girls on the Run, that's going to be dissolved.
I don't know what things were funded for the next year, but as you can imagine, there's a new health needs assessment. And so as a part of the health improvement plan that needs to keep track with the health needs assessment, there may be shifts in funding priorities based on which not-for-profits can contribute most wholly to
I'd
the
be-
needs that were identified.
And I'd be interested to see if we've been able to decrease the overall obesity issues related to our young ladies in our schools, especially our Title I schools. It's, that's a pretty lofty decade worth of work, and I don't know. And so I'd be interested in, issues like that, such as also, I understand you guys are dissolving the contract with Urban Roots, which I know there's a huge issue related to food deserts in our community. And they're doing quite a bit of work in terms of getting that access to healthy foods in our communities. Is that correct?
Yep.
Okay.
We continue to work with Urban Roots.
My understanding is you guys are dissolving that grant here soon, because if you guys are now taking on new priorities. Is that
Let
correct?
me share with you, Councilman, some of the priorities and where they're funded. Co-development of the community health needs assessment, $35,000. HOPES, $210,000. Immunize Nevada, $140,000. Urban Roots, $120,000. Community Health Alliance, $112,000. Girls on the Run, $75,000. Care Chest, $62,000. Children's Cabinet, $50,000. Awaken, which is important for our young women who are vulnerable on the streets, $50,000. Catholic Charities, $9,000. Food Bank, $7,500. Communities in Schools, $20,000. The Nevada Land Trust, $20,000. High Fives, $27,000.
So that's
And
this
there's
fiscal year.
the new Business Improvement
That's this
District.
fiscal year, 18-19.
That is 2017 totals.
So I'm talking about this next fiscal year coming in, as we're kind of starting this new plan. So that fiscal year 18-19, are you guys going to continue supporting some of those partnerships that you highlighted on the PowerPoint?
So some of those partnerships will be supported based on the applications that were, so we took the health needs assessment with the health district. We came
Some
up
of
with
those
the health-
issues are still in the plan. And that's what I'm trying to explain, is that there's still, as highlighted as part of the community health needs assessment, we still have issues in our community related to obesity, still have issues related to access to healthy food, still have issues related to access to health care.
Without a doubt.
The partnerships you had posted on your PowerPoint, I was just asking is, how does one now decide to move away from focusing in on such as missions like the Girls on the Run, which are working with young ladies, obesity issues, self-esteem issues in our Title I schools, to now move towards another priority when we haven't necessarily moved the needle on that one. Then move away from also access to healthy foods when we know we have food deserts within our community, to say now we're not going to focus on Urban Roots, we're going to go ahead and focus on something else, even though we didn't necessarily move the needle. Those are my questions in terms of how those priorities decided.
And it's a great question, and I'm sorry for the fact that it may not be clear. So there are so many great not-for-profit partners in the community doing really good work. And while I would love to be able to support all of them, as you know, clearly, just as you do with the health district budget, there are limited funding opportunities that are available. And so while there may be many reasons why you have to shift funding, the Community Health Needs Assessment and the Improvement Project, the most recent one, are what are driving the guidance for the community benefit programming at Renown Health. Some new entrants will come in, some of the funded people will go away over the course of time because priorities shift. We also want to make sure that they're aligned with ways in which we can contribute not only monetarily, but from an expertise perspective and where multiple entities have come together in the community. But for one example, while we may be pulling back on one obesity project, and while another obesity project may not be funded because it depends on how multiple not-for-profits work together. Example, the school district has limited bandwidth to expand services. If we need the school district to participate with us to make young girls healthy and lose weight, but they don't have the bandwidth to take it on, it makes no sense to fund the project because we've got to have them as a partner in advancing the work for the community. And so we may go down a different path where the school district is involved so that we can make sure we're getting the kinds of tractions at the community level that we need to do to move the measures. So I'm hopeful that is a little bit more information that may be helpful. Again, I wish I had an open checkbook to be able to contribute to all of the not-for-profits, and we all have those not-for-profits have a special place in our hearts, and we contribute to them openly, but at the end of the day, I have to be fiscally responsible so I can do these other investments in the community to make sure that we're driving a health plan that serves the needs of Northern Nevada.
And I appreciate your time, and please give my thanks to your staff, your doctors, your nurses. They do an exceptional job in our community. The quality of care is great every now and then. My only questions today were really geared towards how does one decide where those dollars that you guys are able to collect as being a nonprofit, how are those generated back into our community to continue to tackle the health issues and disparities that we have in our communities. And I appreciate the information. I look forward to seeing what the plan shows in terms of how that plan was created, and in terms of hopefully the next 3 years in terms of what those are tackled, and 3 years from now if those change again, well, I guess it'll be interesting to see your knowledge in terms of how does one start to move the needle if we're changing priorities in terms of just the different partnerships that we have in our community.
Well, again, I certainly appreciate the opportunity to present in front of the board, and by all means, if there is a different way we should be doing this. As a public health professional, I would love to be informed, so please feel free to reach out and we'll have a conversation, see if we can make it better.
Yeah, thank you. Thank you for being here.
Don't go anywhere, Dr. Slonim. We haven't finished. We have more questions. Thank you, Councilman Delgado. Any further questions? Chief Brown?
Dr. Sloan, thank you very much. A lot of information and a lot of work being done over there. We appreciate that. You know, you mentioned your urgent care facilities that were opened in the past and potentially more that are going to open in the future. Are there discussions, or do you see in the near future or the long future the possibility that our ambulance providers are going to be able to start utilizing your urgent cares for the non-acute patients?
I would love that opportunity because the opportunity to make sure that people get to the right setting is huge. Obviously, there's protocol, pathway, guideline that has to be followed so we don't jeopardize the lives of those who are seeking. You know, people think, again, it's a one-size-fits-all. They want the emergency department, but they actually don't really know what they need. And so how do we help to inform what might be the right setting and how do we get them there? That's in large part why this new urgent care is so important, because most urgent cares in town don't accept patients insured by Medicaid. And we want to make sure that it has open access and expanded hours for people who have as their only recourse the emergency department as their place to go. So hopefully opening that up, my guess, probably going to take a year.
Councilman Dare.
Thank you, Madam Chair. Thank you for being here, Dr. Sloan. It's good to see you. And my question has to do with the mental illness and that portion. And I think it's fantastic that we're seeing some movement on this. Obviously, I don't think this one thing's going to fulfill the need at large that we have. It's a beginning and something we're all very concerned about. It seems like almost any conversation we have, whether it's homelessness or even other things, it seems to always lead back to some of our biggest struggles is trying to figure out how to do this. So would you just speak for a moment to maybe the plan? Because I think this, maybe it's not just your issue, but at the same time, it's the beginning of a conversation, probably not the end. And some of the other boards we serve on, I think this is a very important conversation. And I'd also like to know what particular area will your, this new thing serve exactly? So we kind of know when we're sending people how we can help out. Thank you.
Outstanding. Thank you, Councilman, for the question. A couple of things I would say under the umbrella of mental health services. And you raise a really important point. And I think in some ways it goes back to what we've been talking about for the last few minutes. There are problems in the community that no matter how much Renown Health might want to fix them, we can't fix them alone. It's impossible. The current situation that we have in Northern Nevada from a mental health and addiction perspective is something that's been brewing for 3 decades. And it comes from a lack of infrastructure and a lack of investment from a whole bunch of places, not just from Renown Health. I can't be looked upon as the solution set for those public health problems. We certainly understand that. At the same time, it does take leadership to start the train running down the track and start making a difference. In particular, this Behavioral Health and Addiction Institute is funded to do a couple of things. We're really focused on addiction. We're really focused on assessment using a program called ESPERT. That stands for something, the Rapid Improvement Screening something therapeutic. I can get you the acronym. Identify the people at risk, put them into programming to help figure out how we can do that. But for one of the things that I did not mention, in fact, as a part of that work that's going on, I don't know, but it would be important for you as a health district board to know that Washoe County has the esteemed privilege of being the highest county in the nation for adolescent female suicide. I don't know if you know that. And so while there are obesity challenges and there's smoking cessation, there are other things, we've got young girls in high school attempting suicide at rates that outstrip the national average. Well, I'm not going to stand here and share with you that I'm proud of that sentiment. And so we're going to try, and there's a screening program that we're putting into the school systems. Again, a rationale where we've got young women. I certainly understand all the things that affect people's health. We got obesity, we got smoking. I've got young girls killing themselves in school systems, the latest one 2 weeks ago, where we've got to get in there and assess what's going on and why. And it turns out that the demographic is young Hispanic females, which is the highest one. So we've got to figure this out and make a difference. And some of our investment here is going to how do we partner with the school system to screen all adolescents for their risk of suicide and making sure that we're getting into programming that allows those children to live and cope differently with the challenges that they're experiencing.
Yeah. I'm sure it's a very big conversation. Thank you for that information. I appreciate it.
Any other questions? I have a few. First of all, I want to say I'm thankful I'm part of your Healthy Nevada project. I have my 23andMe.
Congratulations.
And I'm sure you can tell by looking at my jaw and my short hairline. I have more than 98% of the population's variants of Neanderthal. You could use that however you want. It's been used every which way we can at home, trust me. And also 0.01% Japanese. Who'd have thunk? So thank you very much for that. And it was a good business for 23andMe too, because I have like my whole family then I enrolled and paid for theirs to do their DNA when I got mine for free. So I look forward to what comes out of all of that research, and I applaud you for that. One thing I want to make very clear, and I don't think he gets enough credit for this, and I tell him to go looking for the credit, but he's not that kind of man, is the seed money for the 89502 project. The very first donor was Commissioner Bob Lucy, because that's his district. A lot of people forget that because it's city, right? But we represent everybody. So I just want to, he had that much commitment to that zip code that and you know, people can be craven with where we give our discretionary funds, but that's really not a lot of voters for him either. It's because it's out of his heart and his belief in public health. So I want to put that on the record. He wouldn't say it himself. Also, this board made it as a strategy, behavioral health is something that, and that is something I've been asking for over, 8 years? that the behavioral health is really the bottom of all the rest of the outcomes and behaviors. That's really the beginning of where all these other symptoms come out. So we are with you on that one, and thank you for opening that, and I will be there for your grand opening. Additionally, I serve on the Nevada Works Board, and I work with all but 2 counties. And they actually come up here every quarter. They drive all that way to talk. And one of the biggest issues that we are facing out in the rurals is we would love to deliver telemedicine. They don't have service. Many of these counties have broadband in the ground, but no major supplier will come and make them live because there's not enough volume. And that is something that we need to work on as a state as well, especially knowing that you now are down in Tonopah with the presence. Let's look at that a little bit more and perhaps do an offline, you and some of the other people to figure out how are we going to lift that, because we can't be the only state in the country facing that. So there's got to be some best practices out there. And like I said, the broadband's already there.
Yep. 2 comments on that, and I agree to take it offline. I don't have, mostly because I don't have the depth of knowledge to know how much. We're very involved in providing telemedicine outreach to the rural communities. In fact, we have a demonstration project with the prison system. The governor is very happy about that because we're preventing prisoners from having to drive 6 hours with 2 armed guards, from a prison out in rural Nevada. There's more we can do. Some organizations, Kaiser included, have said 50% of their visits will be by telemedicine. Maybe it's you may be down the block from your doctor, but still being able to provide telemedicine from your living room versus driving the 1 block, 2 block. We've got to be more creative in those solution sets and how we do that work together.
Right.
One other point, just for the record, I think it's valuable also. The American Hospital Association, I'm honored to serve as the chair-elect of the Systems Board of the American Hospital Association. They are pushing the president in Washington on how are we making infrastructure investments in healthcare, and broadband and wire are the most important things that they're focused on, particularly in the rural environments, because we've been petitioning that the rural environment often gets left behind.
Absolutely. Great. That's wonderful. And I have to tell you, I love your, my husband was in the hospital, unfortunately, a couple months ago for 5 days. Renowned, great care, great service. And one thing that we love more than anything is that he can email his doctor and say, hey, this medication is making my ankles, swell, instead of making another appointment, and losing efficiency. And then the doctor gets right back and says, hey, stop, and here's another one I think you should try. So bravo, that's brand new, especially your TV where you can go in and look at your records at the, I think that is cutting edge.
Getting care where people want it and when is the most important thing, and that will mean expanded access hours. That will mean in locations where everybody's got access regardless of your insurance status. That will mean opportunities to deliver a more consumer-oriented service from a healthcare perspective, like you get if you go to the store and purchase something.
Absolutely. And then finally, I'm not sure where this victim is. I heard it was at Renown. It really doesn't matter. But the Amtrak young man who was hurt pretty bad up in Truckee and found and then brought down here, it is being looked at as a hate crime. And any way you can push any levers, because I'm doing it behind the scenes too, and any of the rest of you that can too. We really don't have jurisdiction, right? It's not Washoe County, it's Truckee. Amtrak is saying that they're the boss of all the investigation. It's not very transparent. So anything you can do from the medical side, I would really appreciate for this young man. Thank you.
Again,
Any other
thank you all.
questions?
Thank you all for your
Thank you so
attention.
much. Come back.
Okay.
Bye. All righty. We are on item 9. Review, discussion, and possible adoption of the business impact statement regarding proposed revisions to the District Board of Health regulations governing air quality. And that is the illustrious Miss Albee. Hi.
Well, thank you.
You're welcome.
Good afternoon, Madam Chair and members of the board. For the record, Charlene Albee, I'm the Director of the Air Quality Management Division. The item you have in front of you today is consideration of the acceptance of the business impact statement that was prepared for the proposed revisions to our fines and penalties regulation. Details of the business impact statement are included in your report. I can tell you that in addition to the legal requirements for public notice and formal workshops, that prior to those, I did reach out and gave presentations to the Associated General Contractors Group and the Builders Association of Northern Nevada as the two groups that would be most impacted by these regulations. And I can tell you that we did not receive any objections to the revisions. And everyone pretty much understood that these would have no impact to companies that were operating in compliance with the regulations. So I'm available if you have any additional questions.
Vice Chairman Novak.
I got the question on particularly section G, where the way I'm reading it, it may be wrong, you have now taken an opportunity for any of these people to say, yep, I'm guilty, I'll write you a check, and let's move on.
I can tell you that I've been with the health district for almost 24 years. And in that amount of time, I have never seen anybody take a check for a penalty that did not come in front of this board for approval. That is not something that we would ever do or that we would even begin to suggest, because we do feel that the rules and the system is set in place, that the assessment of a penalty is ultimately your decision.
Right.
And so that is an archaic piece of regulation that nobody even knows when it was put in, so we just thought it was better to do a housekeeping, so that this, the way it's changed now, all fines will be assessed at the decision of the Board of Health, which is the way it's always been
Okay,
done.
it just
Yeah.
seemed like, okay.
It was, when we started reviewing the regulation, it was one of the things that we looked at and went, what? So it was a housekeeping.
Okay.
Councilman Dare?
I just want to say, Ms. Elby, thank you for going and doing the work of communicating. And one of the things that we've heard and seen is that you're out and have met with AGC, you've met with the different groups, you've done that. And so it makes it to when we have these transitions, they're all on page, no one's surprised, no one anything. So thank you for doing that. I'm sure it's normal protocol, but it's always appreciative when we aren't seeing small explosions out there. So thank you so much.
You're most welcome. I like to avoid those myself.
Thank you.
Any other questions? If not, I would entertain a motion, and please indicate on your motion that you are setting the public hearing for July 28th at 1 p.m.
I'll make a motion to approve and adopt the business impact statement for the proposed revisions to the District Board of Health regulations governing air quality management, and set a public hearing for possible adoption of proposed regulations for June 28, 2018 at 1 p.m.
Second.
I have a motion by Brown, a second by Novak. Any public comment, Madam Clerk? All right. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Thank you very much, Ms. Albee.
Thank you.
Next up, we have item 10, which is the Regional Emergency Medical Services Authority, REMSA. The first is an action item, which is the review and acceptance of their operations report for April. Hello.
Hello, Madam Chairman. Good morning. Good afternoon. I'm J.W. Hodge, Chief Operating Officer of REMSA for the record. You have all been provided our April compliance report, and I'm here to answer any questions you may have about that.
Any questions down at the left here?
I
Councilman
did-
Dare?
I did have one. Thank you, JW. I was just reading on here in one of the complaints, and I want to know, because sometimes I know you guys are going through a lot of turnover and things like that. I saw one that had a verbally abusive thing on here, and that it didn't have a resolve to it. And I not to get too deep down into your report, but just reading through, how do you guys typically handle that? And do you feel, I know we're having overturn a little bit. And so I know when I have overturned anything I do, we tend to sometimes have things happen that we're like, oh, And so if this happened, how you guys handling that overturn, and if this is in here? Because obviously, we think you guys do a great job, but it's very hard when you keep getting new people. And so with that, given that grace and understanding, I just want to throw that out.
Thank you for the question, Councilman. Unfortunately, the way these reports come out, you don't get the continuous follow-up that we go through. So this report comes out with a very brief note of what we do initially. Immediately following any of these, we meet with the crews. They have to do occurrence reports, interview each individually, and then follow up with the patients as well. I can go back to that specific one and then follow up with you directly. I will tell you that I've looked at all the ones that had negative comments this month, and all the ones that we have followed up on, they have been resolved through various means.
Kind of brings me to the question, do you feel like, are we having a hard time? I met a lot of staff. They all seem wonderful, but I'm also inside of some of those situations. Do you feel like we're getting, How's recruiting going? That's probably my question. How's that going?
I think recruiting is going better than we had a while there where there was a limited paramedics in the region, but we have seen more pickup,
Very
and we're
good.
seeing a bigger pool of recruiting, so that's going well. I do think that we are also constantly going through and revamping our customer service training and opportunities to teach crews how to deal with new issues in patient care and new issues in providing healthcare in the field, and I think that's ever-changing as well. So sometimes you run across things where you really can't make anybody happy on either side, so it's an opportunity to provide further education.
Thank you. Appreciate it.
And I think that, I mean, that brings us to a great point. We're at 100% employment right now in this valley. So everybody is going to have to really beef up either your environment, your morale, your pay, your flexibility, all of the above, because everybody is employed, which is a great thing, but it also puts employers at a position that they have to get very creative. So any way we can help as the Board of Health, please let us know to recruit, because I think one of the best recruiting devices we have are the firefighters, because most of our firefighters, Chief Brown, at one point worked for REMSA.
It's true.
So it's a career trajectory, and that's the way you're going to get more people, I believe, once that secret gets out. I'm not sure it's really a secret, but new people here, it would be
Absolutely.
unknown information that is a true path, so.
And I think the work that the board does in providing a better community to live in is also helpful for recruitment when we're trying to bring people from the outside and trying to
Absolutely.
attract them. So the work that you do every day is actually very supportive.
Thank you.
So thank you.
Thank you, Mr. Hodge. All right, any other questions for the ops report? I will entertain a motion.
I'll move to approve the report as is.
I have a motion by Dare, a second by Hess. Any discussion? All those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Do you have anything to add on your public relations report except what is tomorrow?
Tomorrow is not the end of EMS week, actually, Madam Chair. So we are hopeful that anyone comes join us tomorrow at our EMS barbecue and awards celebration. So come out, 11:30 is lunch, 12:30 is the awards. We're going to celebrate the great work that's done in the community all year long, so we'd appreciate seeing you guys there.
Yeah, I will be there as your chair, but I would love to see the rest of you, and so that your emergency service workers can see that we are engaged and involved in oversight, and maybe when we're shaking their hand, say, hey, you get to be a firefighter one day, if you want.
No.
Right?
They're all, no, stay, no.
Right. Mr. Hodge is like, don't tell them. All right.
I did want to provide you one update on the
Sure.
the communication center issue that we had last week with the lightning strike. So as you all are aware, have been made aware, last week we experienced a critical system failure when our building, which we are being told by the technical experts, was either struck or had a near miss struck by lightning. This is the first in our history. I think that you all know that in the amount of time that we've been here. We have backup systems in place. This was a unique situation where the power completely shut off and then spiked back higher than normal. So the backup systems that we test annually through drills and weekly through backup system tests seemed to not work that day. But I will tell you, immediately following the abrupt power loss, all of our regional partners and our team got together. We were in our backup center within 11 minutes. No loss in calls or processing calls happened at all, so we captured all calls. Our operations team immediately also added additional ambulances to the system, and through our regional partnerships with our fire departments, we staffed ambulances at fire stations as well to make sure we had the bi-directional communication and that we were working together as a region. Our main center was brought back online within less than an hour, but through some methodical testing and approach, we decided to keep the backup center in operation for multiple hours to make sure that we had redundancy while we were making sure everything was brought back up safely. And we did actually keep one dispatcher in the backup center throughout the next morning. He was the lone man on the ship down at South Reno, but he did a great job. All initial tests and after systems were brought up, everything's back to normal. We are going through our own internal after-action review, and we do have technicians that actually maintain our power systems, helping us determine if there's any other level of backup or safety that we can put in place to make sure that it never happens again, in the 1 in a million chance that we are struck by lightning once more. Ironically, this week, we were supposed to be having our full-scale communication system shutdown failure drill. Thank you to Ms. Conti and Mr. Dick for allowing us to count the real one as our drill. So, we will continue to work closely with both the EMS oversight team and Mr. Dick to make sure that there's anything that we need to provide back to you, we will. But if you have any questions, I'll answer those now.
Any questions for the public relations report? And I have to say to you, thank you very much to your government affairs director, who immediately, I know, texted me and left me a detailed voicemail message, so thanks, Ms. Sferraza. I didn't know what she wanted me to do. I'm like,
Well,
okay,
we
it's
just wanted you to
down.
be informed.
Don't break your leg.
We wanted to keep you guys informed because
Thank
we
you.
do answer to you, and it was important for us to let you know as well. And thank you for your support. Various members reached out to us to make sure that there was nothing they could do. So thank you for that.
Great, great. Thank you for being great partners with us. We appreciate you, Mr. Hodge.
Thank you,
And I'll
Madam
see you
Chair.
tomorrow.
I'm looking forward to it.
Yeah, me too. Thank you. Item 11 are staff reports and program updates. We have Ms. Albee for Air Quality Management. She has submitted a report, and it looks like she has more information to bring to our attention.
Good afternoon, again, Madam Chair, members of the board. For the record, Charlene Albee, Director of the Air Quality Management Division. In the report this month, there's a map on the front page that shows the areas of the United States that have been designated non-attainment for ozone. And I just wanted to point out that, yes, we are attainment.
Can you put it on the, I have it right here. If you would
Oh.
put it, just put it there so that people at home can see, because I think this is a
Okay.
interesting look at bowls and valleys within our country.
Well, and I think what it does is this actually demonstrates the next challenge that we have, that we are already engaged EPA on at headquarters, is Western Regional Transport. We have the largest non-attainment area in the country immediately to our west, and with prevailing winds that direction, that's where our next challenge is going to come from. So the other thing I wanted to give you an update on is we were contacted by Region 9 regarding the use of our portable particulate matter monitor for the Hawaiian Islands. The Hawaii air quality has really got some challenges going on the Big Island. With the lava now reaching the ocean, pyroclastic emissions, particulate has become a real challenge. We have gotten a hold of Hawaii. We do have a portable, it's our EBAM, that we're just now making the logistic arrangements to get it shipped over there so that they can get that set up. They're widening their monitoring network so that they can actually have near real-time data for their evacuations. So we are working with them. We're just waiting for the address of where to send it, whether it's going to go to the region or go straight to Hawaii, so.
Well,
I
I'd
wanted to let
vote
you
that
know
we all
are-
deliver it
That's what
to
I was-
Hawaii, the whole board. We'll
You
just have a
know-
retreat, I mean, if
in-
Hawaii wants it that bad.
In normal conditions, there's a lot of people that would like to volunteer for that.
I'm sure.
But the current conditions on that island, I have not had a lot of people step up and
Oh, I'll
want
go. I'll
to
go.
run. So it's, when you start hearing about the sulfuric acid rain.
Oh, I've
and
heard it
the
stinks, yeah.
hydrochloric acid now being generated when the lava hits the ocean, it's really not a pleasant place. EPA Region 9 does have staff that are over there running the monitors and setting them up, and it's not the paradise that it typically is.
We'll just drop them off and go to another island.
That's it. So, anyway, I just wanted you to know that we have
Thank you.
responded to it, a call, and we
Wonderful.
will keep you informed.
And
as
let's
to
make
what
sure
can
if we do deliver it, that we use our PIO to talk about how much we work together as a region.
Once we get it there and we figure out how it gets worked, we will definitely bring a report back.
Great. Any
And
questions
I'm
for
available
Ms.
any more
Helby?
questions.
Thank you.
All righty, thanks.
CCHS, item B. Mr. Cutts?
Good afternoon, Madam Chair, members of the Board of Health. Steve Cutts for the record. I just wanted to highlight two things. One is our client satisfaction survey, which is in our report. I am very proud of it. I just want to acknowledge and thank what I believe is my great staff that we have in CCHS that contribute to our ongoing highly rated results. So thanks to all of them. Second is something that we did at the beginning of May that I thought was incredibly great and just overall pretty cool, and that was our Healthy Living mural. I want to thank Chair Jung, who was there and said a few words. We're very appreciative of that, as well as Councilman Delgado, Health Officer Kevin Dick, who was kind of our master of ceremony, so that was pretty cool. Reno Housing Authority, of course, Trainer, and Glenn Duncan Schools, the Washoe County School District, and of course, again, our outstanding chronic disease prevention program team who helped put this together. So if Ms. Rogers is successful with,
Poor Laura.
I know, she said,
Cancer and diabetes. What do all of these diseases have in common? They're the leading cause of death in the country and in Washoe County. So to help inspire healthy living among youths in the Reno area, the Washoe County Health District, the Reno Housing Authority, and local artist Eric Berg worked together to create a healthy living community mural painted on a retaining wall along East 10th Street. The mural, which was completed in about 2 months, depicts the silhouettes of several students from both Glenn Duncan STEM Academy and Fred W. Trainer Middle School. On Thursday, May 3rd, community leaders gathered at the Reno Housing Authority offices to celebrate the completion of the mural. Health Officer Kevin Dick with the Washoe County Health District says all of these diseases are preventable.
There's the boss man.
From all stages of life, but it's especially important that we get children involved in those healthy behaviors so that they can carry them forward throughout their lifetimes.
Both the Glenn Duncan and Trainer are Title I schools, so they have a higher proportion of low-income families with their children attending these schools. And we find in those schools that we have a higher percentage of obese and overweight children. And so I think the wall is a great opportunity to engage the schools and the community around healthy behaviors. Eating well, it features children and their favorite fruits and vegetables, physical activity, and it also emphasizes smoke-free housing and healthy housing.
Mayor Hillary Sheevey, Amy Jones, Executive Director of the Reno Housing Authority, and Councilman Oscar Delgado also attended the event, among others.
You know what's so beautiful is that from the onset when they reached out to me, said they were going to do this, is that the community was involved. That was my first question, is the community involved? And they were. You know, to have the kids as part of the silhouette, to have the kids involved in the painting, to have the kids involved in actually what it's going to look like, meant so much to me. And that's how you know that there's going to be staying power, there's built-in pride, and there's built-in just overall excitement for it. Right? Because as a kid growing up in the neighborhood not too far from here, this wall was where you saw tagging. This wall is where you saw that the weather was beating it up. This is also where you saw that there was possible tension happening with gang issues in the neighborhoods. But now the kids get to, when they go to school and they come home from school, they get to see themselves reflected in art. They get to see themselves reflected in something that's beautiful and brightful colors. They get to see themselves seeing that the foods they eat are healthy. You know, avocados and pomegranate and bananas and everything else. But it also re-emphasizes that keep doing those things, stay active, and be proudful that you are in this community, that you are part of this community.
For the Reno Gazette Journal and USA Today Network, this is Marcella Barone.
Good job.
Yeah, that was pretty cool. Thank you. And with that, I'd be happy to answer any questions you may have.
Any questions for Clinical and Community Health Services? Councilman Dare?
How do I get a mural in Sparks? That was pretty cool, actually.
Give money through the Reno Housing Authority.
Is that who did it? Through there? So, but really, who's the one that did the mural?
So it was Eric T. Burke, and he has a partner, Matt, and I'm blanking on Matt's last name. They're both incredibly talented. As Chair Jung had mentioned, that Eric Burke is nationally and internationally known. And so we were very lucky to get him. We did a request for proposals. We evaluated them. His came out on top. We were very pleased that he very much wanted to involve the community and the kids in the community. And so we were pretty excited about that. And so we worked with him. We did the RFP, and we ended up with the awesome mural for the community. So we're very, very happy, very excited, very proud of it.
Good job.
Any other questions? I do have a question. It was mentioned by Dr. Slonim during the Renown presentation how they do a screening process for students for mental health and behavioral health in their interactions. I'm wondering if the Clinical and Community Health Services, I know I've asked you to make sure that they're food secure. Are we also screening for any behavioral health issues, mental health issues, in any time that we interact with anybody that uses our clinical services?
Yes, we do. We do a very, it's a basic screening, but we do screen people. We do make referrals. We have had immediate referrals immediately to medical and behavioral health facilities for people who are at risk or who have expressed suicidal ideation. And so we do that in all of our clinical encounters.
Wonderful. I should have known. Thank you, Mr. Cutts. And congratulations again. We, 2 weeks ago, or 2 weeks ago, maybe a little bit longer, Mr. Cutt's son received his badge pinning. He is now firefighter for Truckee Meadows Fire Protection District. A captain,
correct.
excuse me, he's a captain. I don't know what any of that means, but I know he matters. That matters to him and it matters to you, so congratulations. He seemed like a really fine young man.
Thank you very much. I appreciate that.
Thank you. 11C is Environmental Health Services. Mr. Westham, do you have anything to add to your report?
Yes, hi, Chad Westham, Division Director, Environmental Health Services. Madam Chair, members of the board. We've had a very good first quarter in Environmental Health Services, and you have the report in front of you. I just wanted to highlight an enhancement that we're working on for 2018. Starting on the first page of the report, there's mention that, as you know, the Environmental Health Division is involved with the FDA Voluntary National Food Standards. And as you read through those and as the division strives to meet those, it calls out that in a perfect world, we'd be inspecting risk level 3 food establishments 3 times per year. So risk level 3 establishments include full service restaurants, casino resort kitchens, buffets, manufacturers of food, and caterers serving potentially hazardous foods. So we have been positioning the division to inspect those establishments a second time in the fall or winter of 2018. However, the fees back from adopted in 2015, they were calculated to include only 1 food establishment inspection per year. So what we've worked on, and we've talked to the industry, staff and I have met with a number of major leaders, including some of the casinos, Gray Basin Brewery, the Peppermill, Circus, and others, BJ's Restaurant. And so we've met with them, and we're all in agreement that we could make use of our reinspection fee, which will be $180 with the cost of, or the slight increase on July 1st, 2018, and they feel that that'd be a reasonable amount to pay to have us out again, make sure that they're safe. And anyway, so we've had lots of meetings, lots of conversations, and we're prepared to take this on. We feel that it's important, and it'll help protect the residents and visitors from dangerous conditions in non-compliant restaurants. It'll also provide added assurance to the entire restaurant casino industry of Washoe County. It's a firm step in the right direction to meet the requirements of the FDA food program standards. So we wanted to bring that to your attention, and for that or anything else in the report, I'm available for your questions.
All right, Dr. Hess.
2 questions. What is the first fee? And then the reinspection is $180. What do you charge for the first fee, first inspection?
Dr. Hess, Chad West for the record. The fees vary based on which category they are. The fees, and I don't have that with me. I can send that to you. They're on our website.
Can you send it all to us? Send all of us that?
Absolutely.
And then I guess, are you going to be doing 2 a year or 3 a year?
No, that's what I tried to narrate through the report is, in a perfect world, we would do 3 a year. We're not equipped for that necessarily. We're not staffed for that currently with some of our other priorities, but we were very strategic and strove for efficiency in the program to where we can get a second inspection done of these establishments. That's going to be over 800 extra inspections this year.
Okay, great, thank you.
Any other questions? Vice Chairman Novak.
I think this is a great program that you put in here,
Oh,
the report.
thank you, Dr. Novak.
Where was it published? This is the first thing I've seen about it. And I think I've got a few things right here in my garage right now that I'd welcome to see this.
Well, Chad West for the record, we have a sub-program within the division that oversees this, and we work with local partners. it was publicized. I don't know all the media outlets, but it was reported that it was successful. And we can actually, if you have suggestions on additional places we can post it or make it known, we'll do that for the next
Yeah, I'd
time.
appreciate this, because I think this is a great program. There's a lot of junk in all of our garages that shouldn't be, and I don't want to see them in our streams, creeks, and dumps just there, so.
Agreed, absolutely.
Next year, let's see if we can't push waste management and everybody to let us know.
I sure will.
If I could comment on
Yeah,
that.
District Health Officer Dick?
Yeah, I believe this program is actually established as part of the franchise agreements that the local governments have with Waste Management, and that it's Waste Management's responsibility to publicize this to the community. So I think we can certainly, work to see how the health district can better support this, but it's not directly a program that's run by the health district through Waste Management.
And I believe that they do it a couple times a year as well.
This is, thank you, it's the first time I've seen this, so. our
It should have been
elected
in your
people-
bill.
It should have been in our bill. Yeah, well, my bill's paid electronically.
Mine
so-
too.
So therefore.
I missed it too.
so
Next
therefore
time,
the
if you could
elected-
let us know, the Board of Health should probably be the first to know.
We've got a dumpster out there.
Yeah.
Understood,
Yeah,
understood.
thank you.
Uh,
Any other
thank you.
questions? All right, thank you.
Thank you for your support.
Item D, epidemiology and public health preparedness. Dr. Todd, do you have anything to add to your report?
I thought I'd just sleep with the draw and had missed it.
Good afternoon, Madam Chair, and members of the board. Randall Todd for the record. I am pleased to report that we now have our final for this season influenza report, week 20. So as you may know, we start the flu season every year in the 40th week of the year, and we run it and we produce weekly reports through the 20th week of the year. So in your board report, you had the week 18 report, and I just received a day or two ago the week 20 report. So we will continue our flu surveillance for the rest of the year, but we're now down to such low numbers that it stops being that interesting, so we stop producing these reports. But we did have, for the week that ended on May 19, CDC's week 20, we had 11 of our 12 sentinel providers reporting a total of 64 patients with influenza-like illness. The percentage of persons seen with influenza-like illness by the 11 providers was 1%, which is below the regional baseline of 2.4%. And during the previous week, week 19, the percentage of visits to U.S. sentinel providers due to influenza-like illness was down to 1.2%. And so we feel pretty good about this. We had one death certificate received for week 20 that listed pneumonia or influenza as a factor contributing to the cause of death. So the total number of deaths submitted for week 20 was 74, and one of those was flu-like illness. So this reflects a P&I ratio, pneumonia and influenza ratio of 1.4%. The total P&I deaths registered to date in Washoe County for the 2017-28 influenza season is 256. So that reflects an overall P&I ratio of 7.9%. This was a significant flu year in terms of laboratory confirmed cases. We had a total of 5,521 cases that were lab confirmed. 542 of those were hospitalized. We had 221, or 40.8%, were vaccinated. And as you may recall, we've talked before that the vaccine, especially for the influenza A component, was not as effective as we would have liked to have seen it be. We had 88 ICU admits, and we had 26 deaths. That 26 deaths is a fairly significant number. It's higher than we've had in any recent flu season that I could find. So that was a pretty sobering number, that 26 people lost their life due to influenza. And so that's actually confirmed influenza as opposed to P&I deaths, which are not confirmed influenza. In other news, it seems like I have to report on this almost every month, but way back in 2016, we had our New Delhi metallo-beta-lactamase producing Klebsiella pneumonia, and we keep getting media interest in this. So
International media.
international media. So we had, I think I reported to you last time, or perhaps the meeting before, about the German television station that actually sent a crew out here to interview us. But more recently, we had two different British media outlets interview us by telephone. They interviewed, the last one interviewed me just the other day, and they will be interviewing Dr. Chin as soon as she's back from her medical leave. And so this just continues to gain a lot of interest.
Wonderful. Good job.
And that's all I had to report especially on, but would be happy to entertain questions if there are any.
Any questions down to my right, left? I have a question.
Yes.
What are we going, can you come back to me before flu season with or whomever is the right staff person, with best practices? Which community has actually moved the needle in terms of people getting their actual vaccinations? Because now that the word is out that the vaccination wasn't that great this time around, I think we're going to have a declining in people getting their vaccinations. And it's completely socially, to me, irresponsible to not get your vaccination because of the herd ability that happens when people get vaccinated, and then that one doesn't. And then we have all these, and then I mean, ultimately death. So can we do some research and put together a good program, maybe with our partners at Renown Health, to help fund it, to really push and drive people to get their vaccination?
Sure, would be happy to do that. Nevada, as a state, has the worst flu
Yeah, well, we're going to
vaccination
change
rates
that
in the
as a
nation.
county, one county at a time. We're going to change that in Washoe County. And there's so many new people here right now in northern Nevada that are used to getting their vaccinations vis-a-vis California. So that will help us maybe just stabilize, but I would like to see a robust, community-wide, hospital-involved, and all other health centers involved push towards vaccinations, and it doesn't give your kids autism, and it doesn't give you the flu and all the other thing, and it's not the government trying to put GPS in your skin or whatever. I mean, I think we need to really hit that hard and be a model county on getting people who are reluctant to actually go get their vaccination.
Madam Chair?
Yes, Mr. District Health Officer.
I believe that it will be in September that we will have Heidi Parker, the Executive Director of Immunize Nevada, here to talk about vaccinations and the flu campaign. So we can, I think, work this into the discussion. And we saw with Dr. Sloanum's presentation, renowned support for Immunize Nevada, and we work very closely with them. So I think that would be a good opportunity to explore that further.
I agree, and eliminate human suffering. Yeah, Dr. Novak, my vice chairman.
I like the idea, and I think maybe look into now timing, maybe more resources financially and whatever, to really put a push this year, because I agree with you. We're gonna have a knee jerk, it didn't work, so I don't need it, along with the typical list that you went on to, so.
Yeah. Anybody else? Yes, Chief Brown.
Well, and I think too, we've discussed it in the past, but partnering up with our agencies that can provide, not only REMSA, but your fire-based services as well. I know we've talked about it before, our health officer and myself, but having the ability to people stop by the station or for them to go out and provide those to the folks that can't get in or out is another way of just reaching more and more of the folks throughout the entire county.
Great idea. Thank you. Any other? Yes, Mr. Young.
I also would like to add that I think that it's great to have a lot of these extra spots that we can get these immunizations, but I think we should really bring it to the public and involve local businesses and try to set up various fun and informative places and places that people gather anyway.
I think we should do that at a brewery.
I think it'd be a wonderful idea. I'll volunteer one.
Okay, great. He owns Great Basin Brewery to the audience out there. He has the best beer. Thank you.
You're welcome.
Office of the District Health Officer, Mr. Kevin Dick, do you have anything to add?
Thank you, Madam Chair. Just wanted to highlight a few things. First of all, it was just earlier this week on Tuesday that the Board of County Commissioners approved the county budget, which has the general fund transfer for the health district within it. And so I've reported to you before that that included all of the additional positions that we had requested. The one exception to above base request being the additional mosquito abatement chemicals that we had requested were not included in there. On the water project.
Excuse me, so what are we going to do about that? Because what I am hearing anecdotally is that this is the worst mosquito year we've had and we can intend to have because we've been so wet this spring. Is there a workaround or?
I'm not sure that there's a workaround, but I can tell you that our vector program is working now on the mosquito abatement plan for what it will take through the season, as well as what we would need next spring as being part of this coming fiscal year. And we'll take that and work with the board to determine what's feasible for us to be able to accomplish with our budget and whether we should be going to the Board of County Commissioners for additional
I think that
funding.
you should, and let me tell you why. I'm sure you read the article about the tick-borne illnesses that are raising all around the country. It's related to climate change. And with dengue fever, Zika, what's the one that we actually do get up here, but we could get any up here, the West Nile virus. Whose faces are going to be in the newspaper if this explodes. It's not going to be the Board of County Commissioners, it's going to be this board. So I think we should push harder and sooner rather than later and reactive. We can look at, the National Weather Service, we actually ought to have them come to our next meeting to give us a report on the wet level and where they see the climate going, not only, out in the future, but just in the next few months, so that can be another way that we can ask the Board of County Commissions General Fund to help us with that. And it's not a big ask, isn't it like 333,000 extra? What was the?
With the flood situation between the spring of 2017 and the summer of 2017, it was actually about close to $750,000 of additional funding that we received from the county commission to deal with that situation.
So we should give them a heads up that we're probably going to need more than that in the emergency, and not in the emergency, in preparation to avoid said emergency, not be reactive, let's be preventive. And you can look at your yard right now and know that it's a very wet spring.
And I agree with you on your comments about the climate change issues. And we've had discussions with the Carson City and Southern Nevada Health District about really state funding for mosquito abatement being part of what we need for resiliency. They do have the Zika carrying mosquito in Clark County now. Unfortunately, they haven't had Zika transmission there, but that's something new that's happening because of
climate change.
Things warming up.
Right, yes. Absolutely.
Madam Chair?
Yes, Councilman Dare.
On that, I've seen in the past, we put together a whole campaign also on how people can help. And I think that's part of the abatement's great, but making sure there's no standing water, all those things. I think I saw some stuff before. If we might really need to buff up on that. Might be a low-hanging fruit as well,
Yeah, because our ditches are full of water. If you go in your backyard, you'll have little standing water. So we probably do need an educational campaign that I'm sure that our communications team at the county can help with as well, because it's a county-wide issue too. It's not just a Board of Health issue.
Yeah.
It's a neighborhood issue. Right?
Total.
I like the idea of the weather service.
Yes, that's actually a great presentation, the weather service.
Yes, thank you for those suggestions.
Yeah.
I do have just another update on water projects. The proposed revisions to the Nevada Administrative Code that are to streamline things a little bit, make things a little bit more flexible, are proceeding to the State Environmental Commission in June. So that will provide, if they are adopted there, there'll be a permanent regulation. Those that aren't aware, if you wait until we're into the next fiscal year with the legislature happening, then it's a temporary regulation, it has to go back again. So this is squeezing in there just in time with that June 27th date.
And you know what another good idea that you could have for funding is to ask for the areas within unincorporated county that have dispensaries, marijuana dispensaries. They're supposed to stay local to that community because everybody fought with each other who's gonna take a dispensary, which by the way, I took 2. And the tax, the 3% that we, yes, personally, the tax that we are collecting from that must stay in that district. So that might be another, and there's a nexus for that, right? Public health, medical marijuana, recreational marijuana. I think that you could make a good case to different commissioners. Every commissioner has a dispensary, by the way, to different, but one of those commissioners, his is not up and running. That's in southern Washoe Valley. That's Commissioner Lucy. But everybody's collecting money right now, so I think you could go to each of them, and that would be something, that's a revenue source that I can make the nexus to.
Great.
Good idea.
Thank you. Just an update and a correction on, in the Truckee Meadows Healthy Communities on page 2 of my report, I had noted that we would be doing a community meeting on the evening of June 14th. Looks like we're actually going to be pushing that back to September in all likelihood. Still expect a presentation to the TMRPA governing board on June 14th. But we did secure funding for phase 2 of the affordable housing project, and things are moving forward with that project. And then I also wanted to announce that Mr. Jim Begbie is resigning his position on the REMSA board. He's been serving as the chairman, and he's the Board of Health's consumer representative appointee on the board. So we'll be posting that volunteer opportunity on the Washoe County webpage and bringing back some potential candidates to you for future appointment for that position. At the last meeting, they did elect Tim Nelson to serve as chairman of the board. So Mr. Nelson is the accounting profession appointed representative by the Board of Health, and I'm confident he'll do a good job in that position.
Great, and it is each board member's responsibility to do the best that they can to recruit for these openings. I would like to see, frankly, a Latino or Latina put on that board as the consumer end user, because I think that we've heard in REMSA's report and in Renown's report that this is an area of people that probably don't have a voice that are accessing our healthcare more frequently. So because of their lack of insurance or because places will not take Medicaid, et cetera. So if you know anybody that would be a good consumer advocate, please get out the word. And it's our appointment. It's not REMSA's appointment. It's not your friend's appointment. We get to be the appointers of that, so. Anything else?
I'd be happy to take any questions.
Any questions? Yes, Councilman Dare.
I have one just on the final page here, and it has the graph of different things and how we're doing, and it's neat seeing things come up, and there's some things that I know you're focused on. I'm wondering on our QI, where it says, says, I'm able to participate in QI without worrying about competing priorities, and then the second one, easy for me to attend. It seems like our quality improvement portion of what we're doing is important to get. I'm just wondering if there's a focus or something we need to be doing here. It seems like it dropped and it never really came back up. If anything, it dropped again.
Well, and thanks for actually in the narrative on this, as far as any statistically significant changes, we had one that was under leadership, innovation, and new ideas are encouraged, a lower percentage responding affirmatively, which is discouraging to me. And under coworkers show confidence and trust in each other and expect a high-quality job from themselves and others, a higher percentage responding affirmatively. So those are the statistically significant ones. But I also wanted to mention that our QI team is reviewing. We've asked these questions for several years, and we're reviewing the questions to see if perhaps there are better questions to be asking. Because this one that asks about whether people have competing priorities to doing QI, I don't know how to take that, because if they say no, then we're not doing a very good job if they're just sitting around waiting to do a QI project. I would expect people should have competing priorities, but that they would feel like QI is important. And so I think that's really what we need to be getting to with that question. And we have our team looking at these and seeing if there's a better set of questions we could be asking to give us information that's better for us to use.
But I do think it's really good that you continue to come back and have a consistency to compare to, and you have schematics, so thank you.
No, thanks.
Anybody else? All right, item 12 is board comment. Do you have any announcements or issues for future agenda items? Start down here to the left.
I just have
Councilman
to
Dare?
let it be known I won't be here at our next meeting, so I'll be out of town.
Okay. Vice Chairman Novak?
Just see if we can invite the weather service. I think that's a huge idea for what's their 3-month, 6-month, 9-month predictions for here. And they're out there.
Mm-hmm. Anybody down here? Councilman Delgado?
I just would like to invite the board and the public to the trainer pool opening on June 11th. I was closed down last year, and so I'm very, very excited to share that it will be open this year on the last day of school. So last day, June 11th, we will open at noon for the community. So hopefully you guys can make it.
I would like to see all of you in your bathing suits. And we're going to go first.
you
I know. I'll be there. Yeah, thank you for saving that and making sure that after the burglary and the destruction that you jumped in there. And that's a place that the community, that if those kids didn't have a pool to go to, they would be in a lot of other nefarious business, as the rest of us would have been if we weren't distracted in some nice way when we were young. I can.
Nefarious.
Good job.
word.
Good job, Councilman Delgado. Any other? All right, with that, I need to go to my final public comment. Anybody wish to speak? All right, we are adjourned. Thank you.